Hi, I'm Dr. Lynn Wagner, and welcome to Doc's Thoughts. Little disclaimer, if you are my child or a friend of my child, you can turn this video off now. I'm getting a little bit of guff at home from my children when I post things that are something they maybe don't want their friends to hear about, so you can go away now. Otherwise, if you're still on, today I'm going to talk about vaginal dryness. So after one of my last episodes I talked about low libido, someone reached out to me and said, WTF, why is no one talking about vaginal dryness? And so here I am talking about vaginal dryness. And basically, there are multiple reasons for vaginal dryness. The main cause is usually loss of estrogen. So as we get older, as we near perimenopause and menopause, and we lose levels of estrogen, we also lose elasticity and lubrication in the vagina. It just makes sense because when you're perimenopausal or menopausal, your body doesn't really think it needs to be reproducing, so it really doesn't think it needs to have any moistness down there. But there's ways around it. But before I get there, other things that can cause vaginal dryness would be breastfeeding. Stress is the cause of anything, so it can definitely cause vaginal dryness. If you're a breast cancer patient and you're on estrogen blocking medications, you will get dry. Autoimmune conditions. Many of the autoimmune conditions will cause changes down there that can make it painful to have sex. The cool thing is there's workarounds for a lot of these. So if it's loss of estrogen and you're not a breast cancer patient, it's usually very safe to use an estrogen-based cream. I use a compounding pharmacy to make mine that you apply twice a week. My patients love it. If you are a breast cancer patient, you would just have to talk to your oncologist before you would use it. Second of all, if you have an autoimmune condition, you can also use estrogen cream, but I will usually add a little bit of naltrexone to it, which we use frequently with autoimmune conditions. They put it right in the cream, and again, you do it twice a week, and that can help out a lot as well. Obviously, just using regular lubrication is great. There's multiple natural lubrications available over the counter at all of our regular pharmacies and Targets and things like that. You can even use things for most people like a gentle, non-scented almond oil. That works really well. So just keeping things lubricated on your own with natural products is really great as well. There also are lasers available. I don't offer this at my clinic, but I send my patients to multiple providers in the area where you can do vaginal laser therapy. It's basically rejuvenating the tissue. It makes it more elastic and lubricated, and women absolutely love it. It's a little pricey, but it lasts for a couple years. Awesome. And then obviously, if it's a stress thing, take care of your stress. Check in with your relationship with your partner if that's something that's bothering you. And then also just take care of yourself down there. You know, we used to think that we had to super clean everything. You don't have to be aggressive with cleaning yourself. You know, if you've heard of douching before, you don't ever want to do that. So you don't have to like go internally and clean yourself internally. You can clean yourself outside, but otherwise your vagina is a self-cleaning organ. I know it's not an organ, but that's what we call it. So don't mess with it too much. Just let it be. Sorry, kids, if you're still listening. But anyway, so I hope that helps. Again, vaginal dryness, loss of estrogen most of the time. Great tips to help it would be adding lubrication, using prescription medications with estrogen in them if you can to help increase that elasticity and lubrication, and consider laser therapy if it's really bad. Hope that helps, and talk to you soon.